Did Medicare eligibility criteria change in 2025? Breaking news for those concerned about Medicare. The question on many minds is whether the eligibility criteria for Medicare changed in 2025. If you are approaching retirement or helping a loved one navigate health coverage, you are in the right place. Let's get straight to the facts. Based on the latest information from 2025, there have been no direct changes to Medicare eligibility criteria reported. Medicare eligibility continues to be primarily based on age, specifically for individuals aged 65 and older. Additionally, certain disabilities and specific health conditions, such as end-stage renal disease, still qualify individuals for Medicare coverage. However, it is important to note that significant changes have occurred in related public health coverage programs. For example, the new law known as House of Representatives, Bill 1, signed into law in July 2025, imposes new administrative and eligibility requirements on Medicaid. This includes mandatory community engagement or work requirements that will start by the end of 2026. Moreover, there are tighter eligibility redeterminations every 6 months for expansion populations. The definitions of qualified immigrants eligible for Medicaid and the Children's Health Insurance Program have also been narrowed. These changes may indirectly affect some Medicare beneficiaries or those transitioning to Medicare. In addition to Medicaid, the Affordable Care Act marketplaces have seen changes as well. Starting in August 2025, the low-income special enrollment period will be paused. This means that year-round enrollment for low-income individuals will be restricted. Furthermore, eligibility for deferred action for childhood arrivals recipients has been removed. While these changes impact Medicaid and the Affordable Care Act marketplace insurance, they do not alter the core Medicare eligibility rules. Medicare continues to be available primarily to those aged 65 or older, certain younger individuals with disabilities, and those with specific medical conditions. Changes in Medicaid and marketplace rules may affect some individuals' coverage options before or after Medicare enrollment. However, the fundamental eligibility standards for Medicare have not changed during this period. If you have questions about your Medicare eligibility or how these changes might affect you, it is best to consult with a knowledgeable professional.